So good morning. Here we are at the Hutchinson Metro Center at University Diagnostic Medical Imaging. Today we're very pleased to have Dr. Mark Prager, who's the medical director of this medical practice. Thank you for being here, Doctor.
My pleasure.
So, Doctor, tell us, how many people do you employ? I know you have a pretty big operation here.
Every day it gets bigger. I believe we have close to 100 employees, full-time, approximately 70 part-timers. We see well over 350 patients a day. All sorts of diagnostic studies and imaging is performed here on a daily basis. And we are the largest private medical facility doing diagnostic radiology in the entire borough, and if not in the entire city.
Now, where are your patients coming just from the Bronx, or are they coming from other places?
They're coming from all over the city. They're coming from Brooklyn. They're coming from, in fact, Israel. They're coming from Canada. We have a lot of specialty work that we do here: interventional radiology, PET-CT scanning for oncology, MRIs, of which we have two. We have the highest field open MRI. It's an MRI without walls on it.
So if people don't want to go into one, they can
and have a very accurate, high-resolution study, and especially in this borough where we're dealing with patients who are anxious, with obesity. We have weight capacity that can accommodate these patients at all times.
So technology is always changing. So what's happening in the field of radiology? Are you introducing new equipment?
Yes, in fact, well, this home of ours, the Hutchinson Metro Center, which I've been here for now going on 15 years, we are presently going to expand and taking over another 3,000 square feet, of which we'll have a state-of-the-art PET-CT scanner with a multi-slice CT scanner, which is more sophisticated than presently that we have. It's a higher resolution imaging device. And we're also opening up an interventional suite. That means we're going to be doing things where we can do biopsies of tumors, catheterizations, biopsies of the liver, of the kidneys, and placing catheters for patients who need chemotherapy and as such.
It just seems that radiology is so important today. When you have a condition, right, you don't know what's wrong. The doctor says, I have to send you for these tests. So really, you're the first stop of people coming in and finding what's really going wrong so they can be treated?
Well, we like to say that we know you from the inside out, so to speak. Medicine and technology has changed such where the old days of listening to your heart, palpating your abdomen, feeling for things, doctors don't have time to do those basic, routine, rudimentary studies. We do. Patient comes to us, it's either ultrasound, and we're looking into your belly, looking at your gallbladder, CT scanning, looking at every part of your body, bone scans, looking at the complete skeleton, MRIs, looking at your brain, your spine, your knees, your ankles, your hands. Every part of your body we can look into and see what's going on.
How long have you been practicing radiology in the borough of the Bronx?
I hate to date myself, but it's 30 years.
That's amazing, Doc.
30 years I've been here. Yes.
Well, you know, we're so happy that you're here providing medical services to the people in the Bronx so that they can be treated properly with the state-of-the-art equipment that you have here. Thank you for all of you do.
Well, I want to thank you personally, Joe Simone, and the entire complex, because it wouldn't be possible if they didn't have the expertise to do what they do.
Doctor, thank you for your time on this
My
beautiful
pleasure.
day.